your best defense against infection, serious illness, or even death. Which is why I'm so pleased to be joined by Solicitor General Sylvia Jones, who along with Minister of Health Christine Elliott has been working tirelessly to coordinate Ontario's vaccine distribution efforts, as well as by Metrolinx CEO Phil Verster. As my colleagues, Solicitor General Jones and Mr. Verster will explain, today we are launching an innovative partnership with Metrolinx to help make getting the first or second dose of COVID-19 vaccine even easier. And I'm thrilled that this initiative is launching right here in my riding of Mississauga-Streetsville. We will be taking media questions following our speaker's remarks. Media is welcome to the photo opportunity afterwards, as well as tours of the bus. I'll now turn it over to Solicitor General Sylvia Jones. Thank you.
Good afternoon, and thank you, Minister Tangri, for that kind introduction. And thanks to Metrolinx for making this announcement possible. As a government, we've been pulling out all the stops to ensure that every Ontarian who wants to get their first or second dose of the COVID-19 vaccine is able to as quickly and easily as possible. With over 80% of the eligible population having received their first dose and over 70% having received their second, this true Team Ontario effort is seeing incredible results. It's clear that the last mile of Ontario's vaccine rollout, the approximately 20% of Ontarians who haven't received even a single dose yet, is a challenging but critically important part of our campaign. To reach pockets of the province where vaccine rates are lower than the provincial average, we've been working with our partners to expand access to the vaccine through methods such as direct outreach from family physicians to their patient base, as well as pop-up clinics at convenient locations such as workplaces and places of worship. To support this effort, this Go-VAXX bus behind me is just the ticket. We are thrilled to partner with Metrolinx to make getting COVID-19 vaccine even easier. Over the summer and fall, Go-VAXX buses will be rolling into cities and towns across the Greater Golden Horseshoe region. These buses will be open to anyone 12 years of age or older. We're targeting shopping malls, festivals, farmers markets, outdoor facilities, community hubs, anywhere our local public health unit partners point us towards to ensure easy access to the COVID-19 vaccine. Go-VAXX buses will be on the road 6 days a week as a fully functioning vaccine clinic with the necessary supplies and trained staff to administer vaccines, offer help, and answer questions. All COVID-19 safety precautions will be followed on board, including the required pre-vaccine screening and post-vaccination monitoring. The spread of COVID-19 has been slow, but it has not been halted, and getting a vaccine remains our best defense against this virus. The evidence is extremely clear. Your chances of getting COVID-19 after being fully immunized are drastically reduced. And even if you test positive, you will almost certainly avoid a trip to the intensive care unit. Here in Peel, 100% of the hospitalizations in regional hospitals between June 1st and July 9th were among those not fully vaccinated. If you have questions about the COVID-19 vaccine, I encourage you to speak with trusted health providers in your life, whether it's your family doctor, your local pharmacist, or even the dedicated medical staff on board the bus to work through any lingering concerns you may have. This bus, and a second vehicle just like it, are the workhorses of the Go Transit commuter network. For the next few months, they will drive the province's effort to reduce barriers to getting a vaccine. No appointment is necessary, so you can get on board the bus to go get vaccinated. I'll now pass it over to Phil Verster, CEO of Metrolinx. Thank you.
Thank you very much, Ministers. The eternally lasting impression I will have after this pandemic would be how fabulous our frontline staff has been throughout the pandemic. Not only did we provide frontline services to people that must travel on a daily basis, essential workers, but we also were very innovative to run buses to move patients between hospitals, to move people in remote communities to vaccination centers. We've hosted vaccination centers ourselves, and it's the innovation that our people brought that helped us to create buses and trains with isolation between seats, and now 2 buses that are fully converted into full mobile clinics. Can't tell you how impressed I am with our people. Fantastic people. And these vaccination clinics is just one more example of how we want to help the people of Ontario, and providing a service 6 days a week, 8 cubicles that we will show you after this question and answer session. It's a fabulous time for us to try and reach those people that have found it difficult to get vaccinations. Thank you very much.
We'll take questions now. There's a scrum mic on this side if you need.
We're open to media for questions.
CBC, Radio Canada. I'm doing 2 jobs here.
Go ahead.
Quebec's introduced a COVID-19 passport. What are your thoughts on that, perhaps, coming to Ontario?
I'll pass it on to Sister Jones.
Okay.
So, as you know, Minister Elliott and I have written the federal minister and asked that they deal with this issue. It becomes very critically important because we don't want 13 different vaccine passports or certificates across Canada. We need the federal government to have a consistent approach so that people who have been fully vaccinated can travel and can move through other jurisdictions. But it really is the responsibility of the federal government because they have those international relationships and partnerships. And I might add, they also need to deal with the over 2 million Canadian citizens who have had mixed doses. You know, we have a lot of people who stepped up and did the right thing and got a vaccine as soon as it was available to them. And in many cases, that involved mixing different vaccines, whether it was Pfizer, Moderna, or AstraZeneca. So we need the federal government to step up and make some decisions on those 2 points. We've been working very closely with them, but as you can imagine, now that people are getting vaccinated, now that we're seeing those 80% numbers, there's a lot of interest and keenness to travel and move into visiting friends and neighbors who are not in Canada.
Yeah, folks can use the mic that's over here. That'd be great for the feed.
Okay. So I'm operating a camera.
Yeah.
I'll just show you. Would the provincial government be for perhaps a COVID vaccine passport to access certain essential services? Some businesses have been calling on for a vaccine passport of some sort within the province itself. What's your government's position on that?
Well, we've been very clear that we have a high percentage of people who have willingly taken the vaccine. The projects like the Go-VAXX bus are going to get that last 15 to 20%. But we think that we're doing some innovative things that don't need to impose restrictions on people. And we'll continue to work with our federal partners to make sure that for international travel in particular, we have a consistent Canada-wide approach. Because as I said, we don't want 13 different passports that different jurisdictions have to interpret.
And just one last question. What's the government's position on perhaps having COVID vaccines mandatory for certain healthcare professionals in order to work in the healthcare sector or those sort of allied industries? Would the province mandate COVID-19 vaccines?
Yeah, again, I will point to the vaccine rates that we have here in Ontario and Canada. We're leading the world in terms of the numbers and percentages of our population. Our long-term care facilities have literally residents that are 100% vaccinated and high percentages of staff who are also vaccinated. We'll continue to offer programs like this to make sure that when people are ready to get that vaccine, they do it. But we do not believe that we need to impose on Ontario citizens when, frankly, they're doing the right thing right now.
One more question. Sorry. There's a contingent within the province, a certain percentage of the population who still hasn't been vaccinated, and they're been a little resistant to it. How have your government's efforts been made to sort of make inroads into convincing those people to perhaps get the vaccine?
It's exactly why we have never landed and focused on one particular way to access the vaccine. You know, early on in the pandemic, we had mass vaccination clinics that were incredibly successful. We're now transitioning and merging into more direct face-to-face conversations with individuals, whether, as I mentioned in my remarks, that's your local pharmacy, whether that's your local primary care practitioner, whether it's the opportunity through the Go-VAXX buses. We are bringing and offering as many different pathways for people to have those conversations, if they are at all hesitant, to make sure that they have all the facts in front of them to make an informed decision. But at the end of the day, the numbers speak for themselves. You know, in Peel region alone, in that time frame of May into early July, 100% of the individuals who were in our hospitals regionally did not have a vaccine. That to me is the most compelling argument for get your vaccine, protect yourself, protect your loved ones.
Thank you, Minister.
Quebec, they announced the vaccine passport, and then Premier Ford say we won't have it in Ontario. But today we have 340 cases. Should we consider to put it back on the table for another wave of pandemic is look like coming?
So again, I will reinforce, you know, we don't want to be in a position where we have 13 different Canadian provinces, territories having different vaccine passports. It really is the responsibility of the federal government to make sure there is a consistent approach. As I said, they have those international relationships. Prime Minister Trudeau has already started conversations with the European Union and, of course, our American partners to the south. So we need to be consistent in what we are saying is the appropriate place and opportunity for travel, and that, of course, is mixing of vaccines that are completely approved by the National Advisory Council on Immunizations as well as Health Canada. And we'll continue to work with the federal government on this. I am confident that as more and more people explain how important it is for them to reconnect with their loved ones in other countries and other jurisdictions, that the federal government will do the right thing and put a program in place to ensure that when you are fully vaccinated, you have the ability to travel.
If there's nothing further, we'll do group photos now.
Thank you.
Okay, how about our first photo? We'll just take a quick shot of the three of you, and then perhaps, Mr. Gerster, if you'd like to invite some of your key Metrolinx staff that have been part of this to join in a larger photo.
Okay.
And
Well, let's do that.
Where do you want me?
just how about by the door, like a little over there by the door? Thank you. 6 feet apart, yes, great.
Go Bear, you've been vaccinated.
Oh, go Bear! Of course, you make the picture.
In the middle.
Perfect. Okay, perfect.
Come.
Mr. Sanday, would you like to join us? This would be part of it?
So some of us can stand to the front and others certainly keep some social
Yeah,
distancing.
just to keep the distance. We won't have, that's perfect. Perfect.
It's like checkers.
Great, thank you.
You don't have to smile.
You do, because you can see it in the eyes.
So what we're going to do now, Mr. Gerster, if you'd like to take the minister and perhaps Deputy Hungry, just give them a quick
Let's do that.
visit of the bus. And then media, any media, I believe Anne-Marie's going to walk it through. Or... Thank you for coming. Yeah, you have a good day.
don't know if we can turn on. It's going to be warm. Okay, perfect. Okay, thanks.
Is this retained for nurses to be brought to and from location? Storage space wherever we can have storage space. So such as over there.
Sorry, I don't know your name. Can let them just tour it because it's really tight in there. Nobody else will be able to get
Just
in.
for 1 second, I just want to make sure.
I'm gonna turn the bus on. But then you'll be able to. I just don't want
It's a big bus, but it's not that big.
to. Yeah, no, it's tight in there.
We good? Come here.
I suddenly heard a tone like Go-VAXX was in trouble.
I'm smiling behind us. Perfect.
You want to go in there? Yeah. Just make sure you stay with distance from people, okay?
And then basically stepping into your Johnny Harmons, right? and so that's the way it worked. And so if we're confined to the bus, then we would wait like 15 minutes after that here. Yeah. Otherwise, we can kick them off the bus. I shouldn't. Well, there's media right there, but they would go off the bus into a waiting area, and then they would have an opportunity to recover.
Yeah, that makes sense. You get more people. And Medivy is doing all of the healthcare, HHR, right?
We're doing all the HHR and your partners as well with Red Cross may also be doing it. I'm not sure about that, but certainly we are here to provide the HR on the bus. Yeah, absolutely.
Yeah, it's a great partnership, I have to say. Right?
Yeah.
It's superb.
Yeah.
Superb. And cubicles as well. So fully private. I think it's a fabulous fit
Right.
out.
And the